Situation, here's a man down. You got to ascertain if it's safe that you come to the area he's in. And if it is, you come and start to examine him and see what's going on. Okay, it's safe. I declare it safe. There's 4 of you going to take care of him quickly.
I'll go call for help, guys.
Okay, help him call. Clever, but not clever enough. Okay, what are we doing? Make it obvious for your people to see what you're doing.
And anybody that's in this room that sees them doing something they're not supposed to, let them know about it.
Luke. Luke.
Luke, can you just...
Are you okay? Check his airway. Sorry, how's your airway?
Yeah.
It's talking. Airway's fine.
Okay, who's touching him?
That's exactly right.
Somebody's got to touch the patient. Okay, that's a start.
Looks like it's got 2 wounds. 3. No, perhaps 3. Yeah, that's
Okay, good.
Okay, where's your tools for that?
When you find something bleeding, what's the first thing you do?
Direct pressure.
Right. So then,
Worry about this wound right now in the head.
It's not bleeding too bad.
Pressure on that.
You want to enter in or pull it out?
Yeah, that's good. With a shrapnel like that, you leave the shrapnel in.
Okay, that's right.
Yeah.
Just put that one
Yep,
in.
we'll go through all that with you guys here in just a
Do
minute.
that too.
what about keeping his neck stabilized? Do you have to worry about keeping his neck stabilized in case there's a head or neck injury? Who does that? Who does that?
Why don't you grab his neck and have somebody else get the call?
Yeah. Hi. Somebody. What happened?
Yeah, very good.
There. Okay. Okay.
Are you sure?
No. We got another way.
You hold on, let him handle it. Thank you.
Feels like it might be broken.
Yeah, expose those wounds. Hey, hey,
Like
hold on to his head.
We need some more dressers.
No, that's Luke.
Okay.
Yeah, that's not.
Is it bleeding there? Where the bone's busted?
Okay,
what-
we're gonna take a break.
Yeah, hang on just a second.
Okay. This is one of the toughest things you'll encounter is multiple injuries on a traumatic patient. Okay? So if you let us, if it's okay with you guys,
Okay, now let's see.
JJ and I are gonna go through and take care of this guy. I need some gloves. Somebody throw me some gloves. Okay, so we've ascertained that the scene is safe to enter into. Take care of you. And we've called for help already. First thing I do when I see something on my scene size up as I'm approaching this patient, I can see we've got a big problem. So, if it's safe enough for me to enter, I'm going to sound the alarm or send someone for help right now. Okay, and I'm going to tell them that we have a category of these things. You know, this is a trauma 1. This would be the nastiest thing you'll see. Trauma 2 is a little less. We're going to call it a trauma 1. So that should be enough information for whoever goes to where your supplies are to bring dressings, bandages, backboards, spider straps, C-collars, and oxygen at the very minimum. Okay? So this is a trauma 1. Go for help. Okay? Okay.
So when we walk up to him, I want everybody to listen. Kind of make a loud snoring, just kind of like you're sleeping. Sound like your dad when he's sleeping at night, kind of sleeping. Make real loud snoring. Come on. There you go. Okay. When you walk up to him, that's what he was doing basically. And what that's telling you, remember when Jay had you guys do the chin to the chest and your airway is occluded? If I'm the person that comes to the head, if I'm Jay's partner and I respond to this, once I sit right here, and I put my hands on him, I'm done. My hands never come off of him until we're finished. If I let go of him and he tries to sit up and he's got a broken neck, you have done him no good at all. It's just all bad. So what I'm going to do is when I take him, I'm just going to take him by his head. I'm going to keep his spine in alignment. I'm going to bring his chin up. And I'm just going to hold him right here. Now Jay's going to tell
Okay,
me
look
what
at
he
the
needs
chin
to have
up.
happen.
That's the nose pointing up. Even though he's laying down, the nose is still pointing up.
What
If
happens
the
when we
nose is
do
pointing
this?
down, we're not getting it.
What happens when we're really nice to him? We do that. Yeah, we just blocked his airway.
Same thing. Okay.
So we're not going to be nice to him right now.
Okay. So as I approach the patient, hi, can you hear me? Yeah, you can talk. Okay. Open your mouth for me. Look at his mouth and nose. I want to look at his ears. I can see I've got a nasty wound there. I'm going to touch right here. Does that hurt as I touch your spine?
If there's blood coming out of the ears, I'd assume you know there's a head injury.
Okay. Does that hurt as I touch your spine back there? It does? Keep talking.
Somebody throw me
Okay,
some
I'm
of those
touching
2x2s
both of these
or
right
4x4s.
here, okay? When I'm coming down, I'm doing this, and I'm doing this, and how, does that breathe in and out for me? In the meantime, I see a bleeder down there. If I've made it this far and I've got an open airway, I've got an open airway, and I'm gonna say, oh, look, I've got a major gusher going on here. What'd you say?
I was just going to tell him now, if I wanted to put this dressing on, say if somebody threw that to me, instead of me going like this, grabbing and putting it on, I can scoot up to him. I'm not going to do it because he has blood all over him, and we both ended up bloodier than the patients last week. I'm going to scoot up to him, put my knees on the sides of his head, and I'm going to squeeze his head between my legs. So I've got his head. Now I can let go of his head, and I can put this piece of gauze on his head. Then I can move back away from him again, and now I've just controlled bleeding on his head. So,
Okay. So as I've come down here, I can see I've got a lesser wound there on his arm. I've got touch this arm, see how this is. Can you move that? Can you squeeze my hand? Yes. Okay. I still got a bleeder here I'm really concerned about. I'm going to put direct pressure on that with my hand as I expose it before I do this wraparound. Okay, I've exposed that. Oh man, that's an ugly one. So I'm going to dress that quickly with the pressure dressing. Several wraps of this makes a pressure dressing. Okay, I have a fractured femur. That's really ugly. That's one of those where you can bleed out a lot. So I'm very concerned about that. But in the meantime, once I secure that, I'm going to go over here and say, oh wow, I got another one. So I'm going to lay that leg down straight. Then I'm going to continue to look. I'm going to expose and look. No bruising. I'm going to touch all four quadrants of his abdomen. I'm not going to push on him real gently. I'm going to push fairly hard. I'm going to rock on his pelvis. If I don't get a reaction and pain from that, that's okay. I'm going to take my hand, I'm going to put my fingers towards his navel, and I'm going to push down on the pubic bone, okay? Always keep your hands up here. This makes your patient secure if you do that way with the heel of your hand, okay? If you do anything else, he's going to reach up and smack you no matter how sick he is. So be very careful. So, what have we got here? I've got an extremity injury there. I have a head injury here. I have a facial is pale. He's been bleeding. He's bleeding a lot here. I got a trauma 1. So I want oxygen on him. I want to put a C-collar on. I want to get him on the backboard. And I want the ambulance already here. Okay? That's how important
And
this
somebody
is.
get the truck to haul him out of the mine up there as fast as you can too.
Okay? So I've dressed this one. I'll put a dressing on that one. And this one over here is really interesting. Does that hurt if I move your arm? Okay, we'll leave it right there then. That's a little trick. If you want to work on your patient and it hurts to move them, and you've already moved them, don't put them back. Leave them right where they're at. Okay? So I'm going to make a unique dressing on for this hand. And a good EMT always has these scissors in his pocket. Right, John? Can I use yours?
What'd you do with those?
I got mine.
Smell like going.
Okay, John's going to let go.
Squeezing his head through this whole
Okay. What I've got here is I've got a unique area I've got to dress. So I'm looking at that and I'm saying, wow, that's cool. Well, that's the kind of warp sense we have who work in this all the time. Sometimes the things that are really ugly to some people are really cool to us. I'm going to come around there like that. And I'm going to stabilize that protruding object in his hand. And then I'm going to wrap it, but I'm not going to move that. I'm going to wrap it really, really well around that. I don't want to take that out right now, okay? because I don't want it to bleed more. I don't want those disrupted tendons and vessels to do anything else and just sit there with that. Often, when you have a protruding object, it's precluding the bleeding because it's put it's taking up the space and pushing the vessels so they're not bleeding to death. You pull that out, the vessels are free to bleed, and you cause more damage. Okay, so we're going to put him on a backboard. Will somebody bring this backboard?
Like you noticed with Jay, when he did this, we talked about this before, there's 3 numbers to kind of keep in your mind. You've got 1 minute, you've got 2 minutes, and you have an hour. When Jay first walked up here after he sized the scene up and he seen everything safe, he's going to do within 60 seconds, he's going from the top of his head to the tips of his toes to look for major bleeding, make sure his airway's open, and he's going to put pressure on the major bleeding and get somebody here to help him. Then he's going to come back, and that's when you see Jay come back up, start doing his abdomen, his chest, talk to him. The 2-minute survey, now you have a chance to ask him, is he allergic to anything? Ask him if he knows where he's at. Ask him a lot of questions through the 2-minute survey. Within 2 minutes, you go through his whole body a second time. You pick up on the piece of glass in his hand, the broken leg, and now you got an hour to get him ready to get him to the hospital. So that's what we're going to do now, is get him packaged up. So,
Quickly now, what are we going to do about these 2 extremities before we roll him? You got a splint?
In the kitchen.
In the kitchen.
there you go.
What kind of splint do you have in the kitchen? What does it look like? What's that?
Possibly a shovel.
Okay, possibly a shovel. Why don't you just tie the 2 legs together? Okay, you've got 2 damaged extremities. This is really ugly. We've controlled the bleeding with the pressure, and he's not going to like whatever you do. So just tie the 2 legs together. That way it avoids one doing this and the other one doing that. They're together. Okay? Who knows how to log roll?
You guys have an air splint in the kitchen, don't you?
We have ours good too.
Okay, that'd be good. I want to roll this patient. Who's going to help me? Come on. Okay, we'll assume we've tied his 2 legs together. Come on this side. Okay, JJ's got the head. That means JJ's in charge of the patient, waiting for any movement. Okay? And what we're going to do, this is already bandaged and secure. And for the sake of time, I'm not wrapping everything 3 or 4 times. But that's secure, all right? So we're going to have to put him on the backboard. How are we going to do it? His legs are tied together. You can leave him alone.
I'm grabbing right here.
Okay, grab him right there. And you, where are you going to be?
You guys pay attention like that.
Why don't you come up on this side also? Okay, and you slide down a little bit. The 3 of us will be right here. Okay, and what we're going to do is this arm is uninjured, so we can roll on that arm okay. All right, so when JJ says, everybody got a hand, you reach across me and I'm going to reach down here. Take your other arm across.
Then we're going to roll you back.
No, do that one there, yeah. That way we overlap.
And it's really important that you talk to your patients and you tell him, you know, Jeff, we're going to roll you up on your side, because if all of a sudden we grab him and start moving him, it's the first instinct. You think you're falling, so you try to react and you try to fight back. Some of the time we're going to roll you up on your right side when I count to 3, okay? Okay, 1, 2, 3. We're going to roll him up. Now we're going to go
Now,
back.
I'm going to feel his back to the spine, make sure everything's okay, all right?
Got
You
it
have to hold
anywhere?
him really well for me. That's why we got plenty of hands. Everything okay? Am I hurting anything? Okay, all right.
Okay, we're going to roll him back on 3. Ready? 1, 2, 3.
Okay, is he straight on the board? He is. That's not bad. However, he's a little bit off here. So, are we going to just push him over? No, why not?
It'll misalign the spine.
Yeah, misalign the spine. Exactly. So to get him straight, we're going to slide him back and forth. So we're going to take him down first,
With these kind of injuries, we want to not pull on the leg there, but
pull the pelvis. Pelvis and shoulders is the only place you go. Cool.
Okay, you ready? We're going to
We're
slide
gonna
him
go
down
down.
on 3. Ready? 1, 2, 3. We're going to come back up on 3. 1, 2, 3. So now by seesawing him on that board like that, we kept his spine in perfect alignment. So now I need a seat collar so we can grab him.
Oh, here, John.
Yeah, no, I'm not touching that. You
That's
can
not the
put that
right way
on.
to do it.
Okay, now which way does that collar go on? You need to look at it before you start putting it on. So make sure we're putting it on right. Is that right? You guys are watching?
Nope.
Chin cup the other way.
Put that collar on here and then try to hold your next one.
Okay, then we got to put something here to block to give him some space here so it'll hold his neck instead of John, because John's not going to move with the backboard. We would use
I
two
used the
towel
other-
rolls.
the other towels, but they go up.
Then we got a C-strap, I mean, spider strap. We don't put it on.
Now we need some tape. Somebody grab, there you go, good job. Now we find out how much you like Jeb or if you don't like him right now.
You'd put a spider strap on, and you would put tape the forehead. Don't they, masking tape on the forehead.
So now we tape his forehead. Let me just show you. I'm gonna let go of him for a minute, which I would not do. Remember. Now, am I gonna take this tape and have Jeb explain to his girlfriend how he lost his eyebrows? And just go straight across to his eyebrows with this tape part of this tape.
If you don't like him,
Yeah, if you don't like him, if he's been a jerk, it's time now to pay back. We have a dressing on his head, and if you remember the angle of your forehead, kind of flat, slopes back a little teeny bit. So when I put this piece of tape on, I'm going to take it on an angle forward. So now I'm putting pressure against his forehead going this direction. Second piece of tape, I'm going to form a triangle. Now this is a really good point where right here. Are we going to do actually, are we going to tape his head on first or are we going to put the spider straps on?
everybody say no.
What happens if I got his head taped now?
And
all
I
of a
come
sudden
along and
Jay
say,
comes along?
hey, what happened? Bump.